Hi, my name is Dr. Isaac Lance, aka Don Dada, ain't nobody better. And today we're going to be talking about a very famous topic known as fucboiosis. Now, what is fucboiosis? Fucboiosis is an abnormal condition of a man whereby he has an excessive need and desire to engage in sexual activity with a woman or a man. I mean, this is 2019. Without regards to whoever he hurts in the process and with no respect to himself. First, there is a predisposition. Now, when a man is born, he is born with two genes. The first one is the ugly gene, and the second one is the fine boy gene. When there is a mutation in the fine boy gene, this individual is at risk of contacting the pathogen responsible for fucboiosis. His friends, does he flock around fuckboys? Yes, he is a fuckboy. And most importantly, immaturity. Now, immaturity is the underdevelopment of the mind, not correlating to the age of the patient. Let's go ahead and talk about the pathogenesis of fucboiosis, and for that I'll let Dr. Isaac Lance handle it on the digital board. Doctor, welcome back, guys. Now we're going to talk about the pathogenesis of fucboiosis. The pathogen that affects the individual is called Etiology. Etiology gets into the individual intraocularly or intrahearally, that is by what he sees or what he hears, and generally by what he's around. Now when it gets into the individual, the first place it goes to is the blood. Now when it gets into the blood, this pathogen attaches itself to proteins, which helps move it around the body into different organs and different vessels. The first vessel it gets to is the superior vena cava. In the superior vena cava, it moves transsensually, that is against the flow of blood towards the brain. Now when it gets to the brain, it affects meninges of the brain. Some of the meninges that it affects are what? The arachnoid matter, subarachnoid matter, and the pia matter. When it gets to the pia matter of the brain, what we see is what we call fucboiositis. That is the inflammation of the pathogen in the brain leading to hemorrhage, serious bleeding intracranially of the individual. Now when this happens, the frontal region of the brain is compressed. This frontal region, as we all know, is responsible for speech, locomotion, cognitive thinking, and generally fucboiosis. Now we'll return back to Dr. Isaac Lance, where he will teach us about the symptoms, diagnosis, and treatment of fucboiosis. Thank you very much. Welcome back. As Dr. Isaac Lance has clearly stated, this disease mainly affects the brain. Some of the symptoms you can detect quickly are his language. Haha. Number 1, send me a pic. Number 2, you up. 3, what are you wearing? 4, heart eye emojis, tongue emojis, eggplant banana emojis, peaches emojis, wet emojis, water sliding emojis down to your thighs and into your baka boom boom emojis. Vampire syndrome. Haha. What is vampire syndrome, you might ask? This is the inability of a man to communicate with you during the hours of daylight, because this pathogen is allergic to sunlight. A fuckboy will never try to communicate with you or text you when there is sun. It's only during the darkness that he thrives. Someone else could possess these symptoms but doesn't really mean he's a fuckboy, but usually fuckboys come with these symptoms. These are: 1, his phone is always on silent. His notifications are always private. He puts password for every single application on the phone. They know how to dress very well. I'm talking about nice trench coats, beautiful turtleneck, sweet skinny pants, Chelsea boots, nice fade hair, beautiful eyelashes, cute beard, smelling nice with cheap Zara perfume, fake Rolex. Oof! Oof! That is him. That is him. Just say, brother, that is you. Go to the doctor. You need a help. First, we perform routine tests, CBC, complete blood count. What do we see? We see an increased level of stupidocytosis. What is stupidocytosis, you might ask? It is the level of stupidity of the individual has reached a peak. We also see an increased level of ESD. What is ESD? Extreme sexual drive. The normal average man requires sex on average 2 times a week, but someone affected with fucboiosis requires it 2 times a minute. He just finished it, he wants it again. So he will look for the next lady to provide it, which you probably don't have stamina, drink milk and banana. CT scan or MRI to detect where the pathogen is in the body, like my brother said, superior vena cava, the greater vessels, the brain, or the meninges. When we detect it, we use the ectometer, and we ectometer, yeah. But the gold standard for detecting or diagnosing someone who is infected with fucboiosis is thirst trap. Ladies, ladies, you know what I mean. This is what I call social seduction, right? Okay, let's just take, for instance, Friday night you get back home from school. You're taking a shower, or no, a bubble bath. And then innocently, well, it's not really innocent, you know what you're doing. You post a picture of your thighs in the bathtub. Your thighs with a glass of wine and some grapes. You post it and you'll be like, mood, chilling time, me and myself. You know, something like that. A fuckboy does not possess the ability to ignore this. Heart eye emojis. Oh, send me a pic. Once you see this, after setting a thirst trap, infallibly, this is a fuckboy. No need to further go further. Just stop there and say, hey fuckboy, get thee behind me, evil of Satan. Some treatments are available. Some of them you need to take to avoid these fuckboys, and some of them they need to take to stop being a fuckboy. What do you need to take, you might ask me? Listen, 1, you need to take ignorpressine. Ignorpressine will be taken at most 4 to 5 times a day, depending on the length of his trench coat. If the trench coat is quite long, you need to take 500 kilograms of ignorpressine 5 times a day. If ignorpressine doesn't work, what can you do? Blocknizolone. What is blocknizolone? It's almost like a vaccine. PPV, potential protective vaccine. It may potentially protect you for the short run, but it will protect you. But if you are already affected and you are already a fuckboy, you only need to take 1 drug. Growupazine. Growupazine. Take that shit 1,000 kilograms each day for the rest of your life. It's life treatment. You cannot just do it today and give up. Life treatment, because it will come back. And if everything doesn't work, you know what you need to do? Surgery. Locate the pathogen in the body, find it, remove it. Prognosis are very simple. If detected early, in the early stages, it can be treated properly and the person will live a happy and beautiful life. The final stage, by the way, of fucboiosis is called ashawo. So if you know anyone affected with fucboiosis, or you yourself have been affected with fucboiosis, visit your nearest clinic and get some treatment, get some help. I remain your favorite doctor, Dr. Isaac Lance, and if you do have any questions, comments, please leave them in the comment section below. My team and I will do our best to get back to you soon. I remain your favorite boy, Dr. Isaac Lance, aka Don't Dada Nobody Bada, and I'll catch you next time on Study with Dada. Be safe. Ain't nobody